Okay, folks. All right. So first, I want to thank my colleagues, Senators Murphy, Van Hollen, and Hassan, for joining us here. Now, over the coming days, weeks, and months, health insurance companies are going to begin requesting rate increases in states across the country. We already have seen the beginning of this, with both Virginia and Maryland requesting huge rate increases that are going to empty out the wallet of far too many working families. If these early states are any indication, health insurance companies are going to ask for huge hikes in the wake of President Trump and congressional Republicans' repeated efforts to sabotage our health care system. And we Democrats are going to be relentless in making sure the American people understand exactly who is to blame for these rates. Republicans control the presidency, the House, and the Senate. The rate increases would be on their backs normally. They're supposed to be in charge, but more so because they have actively done things to increase rates on families. Since President Trump took office, Republicans have worked day in and day out to systematically dismantle our health care system, despite promises the president made on the campaign trail. Here's what President Trump said when he was running, quote, he's going to take care of everybody, quote, deliver health care that is far less expensive and far better. Clearly, their efforts were all a ruse to put the insurance companies back in charge and force Americans to pay more for less when it comes to health care. Once again, in keeping with the theme of putting corporations and special interests before the well-being of the American people, the Republicans have tried to sabotage the system. Let me be clear. The increase in health care costs for families in Maryland, Virginia, and throughout the nation are a symptom of Republican sabotage, and they will be wholly responsible for each and every rate increase we're going to see forward. Don't just take it from me. Take it from former HHS Secretary Tom Price, an architect of much of the sabotage, who just last week, like our colleague Marco Rubio, laid out the naked truth about the Republican tax scam for the rich. Here's what Secretary Price said, quote, he believes that repealing the individual mandate will actually harm the pool in the exchange market, and consequently that drives up the cost for other folks. This is not a Democrat. This is Secretary Price, the Republican-appointed HHS secretary who was in charge, saying Republican acts in Congress and in the White House are causing premiums to go up. So I'll close with this. President Trump and the Republicans promised America a better, cheaper health care system. But instead of working with Democrats to achieve more affordable health care for Americans, they took the partisan route and made things worse. Simply put, President Trump has dropped the ball on health care, and the American people know it. Senator Murphy.
Thank you, Senator Schumer. So it's not rocket science to try to figure out why this has happened. And I just want to take a few minutes to walk through this very deliberate campaign of sabotage. Since the day that Trump took office, he has had one goal, which is to weaken the American healthcare system as a punishment to President Obama for his work on the Affordable Care Act. Within days of coming into office, President Trump signed an executive order instructing all of his agencies to start to undermine the American healthcare system. He then reduced enrollment outreach funding to try to assure that less Americans would know about the affordable options that are available to them. He then shortened the enrollment period so that less Americans would have the chance to sign up even if they managed to find out about it. He canceled cost-sharing reduction payments, which the insurance companies have attributed to a sizable portion of the rate increases that they are filing. Along with Congress, he and the Republicans here repealed the individual mandate, which keeps these insurance pools evened out between costs for sick and well. And now they are trying to push forward a new rule that will allow for junk plans to be offered to consumers, which will further compromise the health of the existing small group and individual plans, raising rates to even higher catastrophic levels. The Commonwealth Fund released a report last week showing that since President Trump took office, 4 million Americans have lost their health insurance. Those numbers are going to continue to spiral upwards if this campaign of sabotage continues. We're just beginning these rate filings. All throughout the summer, insurance companies will be filing rate increases. Already we are seeing some plans requesting rate increases of almost 90%. Senate Democrats will be on the floor of the United States Senate every week talking to the American public about these rate increases and making sure that they know that this campaign of sabotage begun in the first week of the Trump presidency is to be held solely responsible for these gigantic increases.
Senator Van Hollen.
Thank you. I'm just going to add a couple points to those of my colleagues. The first is that rising health care costs are at the top of the list of concerns of people throughout the country. Our senators from every state are finding that as they go to town hall meetings and talk to folks in urban areas, rural areas, and suburban areas. And it's very personal to people. I mean, this is a pocketbook issue. This is a question of trying to make ends meet and pay your health care bills. That anecdotal evidence that our members are getting in the field, are backed up by all the polling data. Every national poll I've seen recently shows that health care costs are at the top of the list of concerns of the American public. Second, the American people are onto the fact that these rising costs are a result of Republican policies, Trump administration policies and policies of Republicans in Congress. March, CNN had a poll showing that by 56 to 36, that is a big margin, 56 to 36, the public trusts Democrats more on the issue of health care and health care costs. It should not be surprising, given what you heard from my colleagues. We just passed the one-year anniversary of the Republican effort to totally blow up the Affordable Care Act. And the reality is that when rural hospitals and the American Cancer Society and the American Diabetes Association, when Americans rose up, not on partisan grounds, but on health care grounds, to stop that, what happened was the Trump administration, Republicans decided to try and kill it by 1,000 cuts, including the poison pill they put in the tax measure that recently passed. And as a result, you're seeing these very rapidly increasing costs, including one of the plans in Maryland calling for a 91% increase. And I just want to read a quote from Chet Burwell, who's the head of Care First, who minced no words as to the cause here. And I quote, this is from Care First, quote, continuing actions on the part of the administration to systematically undermine the market and make it almost impossible to carry out the mission. That's why health care costs are going up. The American people are onto it. And I can assure you that our colleagues are going to continue to do everything we can to bring those costs down. But we're fighting an administration and Republican Congress that's determined to take us in another direction. The last thing I'll say is you look at the Republican budget. They call for cutting Medicare by $473 billion. They call for cutting Medicaid by $1 trillion. That is what was part of the budget. Tax cuts for the big corporations, increasing health care costs for everybody else. And now I'm very pleased to hand it over to my colleague from New Hampshire, Maggie Hassan, who's been a tenacious fighter on this.
Thanks, Chris. Well, thanks, Chris, and thank you to Senator Schumer and Murphy as well. Look, when congressional Republicans tried to repeal the Affordable Care Act last year, the American people made their voices heard, and they defeated those attempts. I am always struck by the number of people who came from all around the country, sometimes at great hardship, especially for families with young children who were medically compromised, but made their way to the nation's capital to let their elected representatives know what health care meant to them and what a repeal of the Affordable Care Act would mean to them. I watched parents talk about this as they tended to children with tracheotomies or oxygen tanks. Health care matters to the American people, and they made that clear last year. And as a result, we were able to defeat the outright repeal attempt. But unfortunately, the Trump administration and congressional Republicans are sabotaging the health care system in other ways, including, as you heard from my colleagues, expanding these junk insurance plans that discriminate against people with pre-existing conditions. And I think it's really important for the American people to understand that these superficially attractive plans, because they're lower in cost, aren't going to cover what you need them to cover when you actually get sick. But that hasn't stopped the administration from expanding those plans, allowing those plans to discriminate against people with pre-existing conditions. The administration also, and the Republicans in Congress, made sure that the Affordable Care Act's coverage requirement was repealed in their tax bill. So the individual mandate is gone, but as we now know, that raises health care costs for millions of Americans, making it harder for millions of Americans to get the health care they need, all to give a massive tax break, massive, to corporate special interests and the ultra-wealthy. And as Senator Schumer pointed out, even former Secretary Tom Price, a Republican, said that repealing the coverage requirement, quote, harms the pool in the exchange market, and consequently that drives up the cost for other folks in the market. I don't often agree with former Secretary Price, but he made clear what we all know to be true. Sabotage from congressional Republicans and the administration is raising premiums, and it is hurting hardworking Americans. I hope that the premium increases we are seeing serve as a wake-up call to my Republican colleagues. It's long past time to drop partisan efforts to undermine our health care system. I hope very much that my colleagues will come instead to the table and work with us to make health care more affordable, because we need to take real action to lower health care costs, including addressing the skyrocketing cost of prescription drugs. I stand ready to work with anybody who's serious about doing that. The American people consistently and repeatedly ask us to do that. They solve problems every day at home. The least they can expect of all of us is to do it here in Washington. Thank you.
Thank you to my three colleagues for their great remarks. Questions?
So when you announced your opposition to the Iran deal in 2015, you said it was just a matter of time. If they would be patient, they would get their nuclear weapon. You essentially say that what the president's doing today is the right thing based on that premise from 2015?
No. There are no reports that Iran has violated the agreement. And to me, the greatest worries from Iran are not right now the nuclear side, but rather what they're doing in Syria, what they're doing to arm Hezbollah with rockets, what they're doing with ICBMs. And to me, the right thing to do would have been to try and come up with our allies with an agreement on those issues and let the nuclear part of this continue as is, because it's not being violated in any way. By dividing our allies, and I've just heard the President said he would impose secondary sanctions on European and Asian allies, you're making it harder to go after Hezbollah, you're making it harder to go after Iranian activities that are really dangerous, and you're probably making it harder to come to a North Korea deal.
Mr. Eric Schneiderman stepped down. Did he do the right thing?
Absolutely. When I read what had happened, I was just aghast, and I was glad that Attorney General Schneiderman quickly stepped down.
I just asked Senator McConnell about your endorsement of his hemp bill. He said he's not going to send that to your marijuana decriminalization bill.
Oh, come on, Mitch.
Why do you now analyze hemp bill? And if your leader will see, if you become majority leader, will we actually see marijuana amendments?
Look, 62% of all Americans are for legalization of marijuana. We just called for decriminalization, let each state decide, don't have federal enforcement in the states. And so I think this is something that is long overdue, and I would hope to see it happen. I would hope that the feds would take the heavy hand off and let each state decide to do what it wants to do.
Senator McConnell, when you're talking about the Obama, said there may be a role for Congress in terms of implementing new sanctions or new sanctions regime. Is that something Democrats would be amenable to, or because of the pull-out, everything kind of...
No, you have to see what they're proposing, but I don't see a path. This is a little like replace and repeal. They had these words, they used them in the campaign, and they don't have a real plan here. I don't know how the plan works by dividing our allies. What do you do with the IAEA? What do you do? How are you really going to enforce these sanctions against other countries? I just don't see a concrete plan emerging. And when I spoke to the Vice President, I asked him a whole lot of questions and didn't get good answers.
What's your take on the Gina Haspel confirmation, and do you think she could draw down the premise?
Look, I'm awaiting her hearing, her public statements. I think those will be very important before making up my mind in any way, and I think that's true of just about all of our caucus.
There are a number of Republicans who are concerned about Don Blankenship's candidacy, the chance that he might win in the primary in West Virginia today. What do you think that the success of Don Blankenship means to the broader...
Yeah, I'm not going to speculate till we see the results.
Mr. Waiter, following up on Mr. Schneiderman, can you explain why you chose to remain silent last night while you saw leaders like Governor Cuomo and Senator Joe
Well,
speak out?
Story came out at 7. He stepped down at 10. He did the right thing, and I'm glad he did.
Would you encourage your former aide, Mr. Brar, to seek that office?
It's only a day after he stepped down. I'm not going to get into speculative candidacies.
On rescissions, what's Democrats' strategy with this?
Well, these rescissions are outrageous. Going after CHIP, a program that's had broad bipartisan support that helps working families pay for health care for their kids, which has the broad support of the American people. The hard right, the Mulvaney wing of the Republican Party, seems to have the upper hand against what most Americans want. Furthermore, you know, Leader McConnell and I and Chairman Shelby and Vice Chair Leahy, we had a good meeting on approps. I think doing these types of rescissions in the Senate would sour the ability to get approps done. Okay, thank you, everybody.
Can I ask you a question? When you're